Hope you're all doing well today. My name's Husain. I'm the director of Metis Health. Now, to get us started, I'd like to introduce you to one of your fellow colleagues. Some of you might be familiar with him. His name is Paul Clarke. He is the head of facilities at the Betsi Cadwaladr University Health Board. And together with Metis, we've developed an all-in-one portable disinfection system. So Paul's going to explain his journey with us and why it is that they've switched over from their current HPV systems to our Hydra system.
My name is Paul Clarke. I'm the head of facilities management for the Betsi Cadwaladr University Health Board. And this afternoon, I'd like to give a presentation in regards to our case study around the alternatives to the use of hydrogen peroxide vapour. Okay, so who are we? Betsi Cadwaladr University Health Board. Quite a complex name and a very complex organisation. The Health Board is responsible for improving the health and well-being to a population of around 678,000 people across 6 counties, across the 6 counties of North Wales, Anglesey, Gwynedd, Conway, Denbighshire, Flintshire and Wrexham. It's an integrated health board which has both acute community primary care as well as GP practices, dental and other health associated services which are supported by the health board. It's quite a large organisation. It's probably one of the biggest in the UK. It's got 3 district general hospitals, each of 500 beds, 18 community hospitals, 90 health centres, 105 GP practices, mental health units, dental surgeries, community health services, and it's also got one of the biggest prisons in the UK, HMP Berwyn, which is based in Wrexham. And we've got around 130 wards, which equates to around 2,400 inpatient beds. So let me just talk around our story and where we started with HPV and UV. We first trialled and purchased HPV back in 2012 when it was still quite a new innovation to the NHS. And we then subsequently moved on to look at UVC in 2013, when once again that was quite a new innovation to the NHS. Over the years, we've accumulated quite a big collection of HPV and UV systems, and we've presently got 9 HPV machines that we use and 18 UV single tower units. And over the last 10 years, we've probably trialled most HPV and UV systems on the market, whether that be standalone systems or some of the robotic systems that are now available. And to support all that program and innovation that we brought into the health board, we've also agreed a really good methodology for environmental cleanliness and final disinfection in the way that we actually use each piece of equipment and how we actually decide, depending on the particular case, what particular piece of equipment we're actually going to use for that. And we call that document what clean do we mean. Okay, so that's the health board. Now let's move on to actually talk about hypochlorous acid and the case study which we want to present to you this afternoon. So first of all, I'd just like to say, why Metis Health? Well, Metis Health, following our research, came across as a really active leader in the production application of hypochlorous acid, which really did kind of come to the fore when we actually looked at the innovation and its uses that are available to us within the health board. And you know, that's a case that you know, there's different methodology in regards to how you can actually use it, and the one that we were really interested in was the misting process to actually replace our HPV processes. So once again, why Metis? Yeah, and they're a leading provider in hypochlorous acid, and from the evidence that was provided, and this evidence wasn't just purely around COVID-19. It was evidence that had been collated over some kind of 10 years in regards to the effectiveness of hypochlorous acid and how it can be used, and also some of the efficacy data which was available to support the trials which we were undertaking. And we were really interested, obviously, in COVID-19, norovirus, and C. diff, which are, fundamental in regards to infection within our hospitals. We also looked at the time, and one of the big issues we have with the use of hydrogen peroxide is the actual length of time that it takes to undertake the process, be that the dispersal, the dwell time, and then the time that it takes to actually break the product back down into oxygen and water, so it's safe to reoccupy the facility. What we found with hypochlorous acid, that it works in seconds, and it makes a great deal of difference in regards to the time it takes to undertake the process versus what we were doing against hydrogen peroxide. And the first initial trial that I saw took around 17 minutes to actually undertake the process. So for me at that point in time, I started to think, well, we're looking at an alternative to hydrogen peroxide vapor. Well, actually, this is also an alternative to UV, and I'm sure that those that use UV have a full understanding about some of the constraints around distance and time and shadowing, which we get with that particular product, which we don't find with the use of hypochlorous acid. As I mentioned before, we were looking at misting, but it also comes in spray and wipe, so that could be used on the hard and soft surfaces, as well as the fogging system, which we were interested in use during our trials. So the other big reason for looking at Metis Health as a company was, they provide, as I mentioned before, they've been doing research around this product for some 10 years, and they have all the documentation, or the authorities in the UK and Europe, to actually use this as a product in healthcare, which was really important for us. I know that there's been a lot of talk around hypochlorous acid and its uses in the past, but a lot of the restraints, one, has been around the actual product itself wasn't particularly stable, where this product is very stable, and I think later on in the presentation one of my colleagues will actually kind of cover that in a little bit more detail. But they've got all the authority, they've got all the registration, so actually it made for us the perfect company to work with, and we've been undertaking our kind of extensive trials with the product now for coming on 2 years, which has really given us some very good evidence and really good efficacy to actually allow our organisation to support the change from the use of hydrogen peroxide to hypochlorous acid. Okay, now we'll move on to the case study. So if I can hand over to my colleague, and they will take you through the actual findings from the case study within Betsi, Cadwaladr University, and then we'll go into a little bit more detail in regards to the product and how it's used within a healthcare environment. Okay, thank you.
Good afternoon. I'm going to take you through that case study. The work that we've been doing with Paul and his team in Wales covered 2 trials. So we did the first trial towards the end of 2020, so the pandemic didn't get in the way of doing these trials. And then subsequently, we did a much bigger trial at the beginning of in 2021. So as Paul mentioned, we've been working with the Trust for over 2 years to get to this point where hypochlorous and the Metis system is being rolled out. The first trial, so I'll take you through both, but the first trial was quite small. It was undertaken in 2 individual rooms on a paediatric ward. And at this point, I must say that this is no replacement for cleaning. So this is the rooms were cleaned with bleach before the misting took place. This is the extra added cleaning element. For the first trial, we did both ATP and microswabbing. We as an organisation prefer microswabbing, but ATP is quite useful just to look at immediate results. But microswabs were taken in various places around each of the rooms and sent to independent lab for testing. And those are the results I'll take you through in a moment. So Solvent is the hypochlorous that we use within the system, and we tested 2 different delivery systems. The final one, which is being rolled out, is downstairs in the main exhibition room, so you'll be able to see it if you want to after this presentation. So first of all, the room was cleaned. So we did a pre-cleaning swab, we did a post-cleaning swab, and we did a post-misting swab. So we looked at it at each of those interventions. Again, we'll show you the ATP and the microswab analysis results. So this is just room 1. So this was the ATP, which is looking at relative light units. Again, we prefer using the microswabs with the colony-forming units, but this again just shows the pre-mist counts in different areas within the room, and then the post-mist counts showing that the reduction, immediate view of the reduction in germs and bacteria that were present in the room. However, the micro is what we like to look at. So again, we looked at various different elements in the room and lots of different materials as well. So from hard to soft surfaces, looking at getting as wide a reach as possible. So from bedside cabinets to the soap dispensers to light switches, bin lids, etc. And I must say that actually the NHS trust that we were working with have very robust cleaning. They have very, very low counts even after cleaning. But as you can see from these results, that it went down to less than 10 CFUs after the misting as well. So it's that extra element of cleanliness. And it went down to 0 logs after misting. Again, room 2, just a similar room. We did the same process. So we looked at the ATP initially, but the main thing for us to look at was the microswabs in there. So again, very good quality of cleaning, but you'll see from the bed rail, for instance, at the bottom of this chart, and the spine of a folder at the end of the bed, the counts were higher than the rest of the room, but after misting, they've significantly reduced. There is no set guidance as to what CFU should be present within healthcare. However, I know Stephanie Dancer, who spoke this morning, in conversations with her, her recommendation is around 250 per 100 centimetre square, and we're using 100 centimetre square swabbing areas. So the fact that we've got down to 20, 30, 40, but in the majority of the cases less than 10 CFUs is really promising. From that first trial, we can draw some conclusions that the standards of hygiene are really high within that hospital anyway. However, some places are missed, and that is just normal human error. There's always going to be some areas that are missed in a general clean. We used 2 different misters, and obviously one of them has now gone into production and being rolled out in Betsi, Cadwaladr. With the Mr. A, it reduced counts to less than 10 CFUs in all areas of room 1. Mr. B was less successful, but it was still less than 10 CFUs in 66% of the areas in the room 2. This initial trial showed us and gave us confidence that there is an additional benefit to misting with hypochlorous acid above and beyond the cleaning. We've worked with various care homes in the last 10 years. We've worked with the World Health Organization. We've recently done a trial in Nigeria. We know that this works, and it was really, really promising to see it within a UK health board. So this then got rolled out to a bigger trial. So again, I've got similar results to take you through. So the larger trial took place in October 2021 at 2 acute hospitals, one community hospital in a variety of rooms. Again, we wanted to see how different rooms, how clean they are to begin with, but also how effective the hypochlorous misting was. We did a total of 52 swabs across those sites. Again, we did a pre-clean swab, a post-clean swab, and a post-mist. So, yes, swabs were taken from 2 areas within this community hospital, which was the first one we did. So we had a side room, so it was swabbed, then cleaned, then re-swabbed, then misted, and then swabbed again. And again, the same thing was done within the wet room. The amount of time it takes to use the hypochlorous misting depends on the size of the room. But typically, so in these 2 rooms, the side room was particularly small, so we misted for 2 minutes, and then had a 5-minute dwell time. The larger room was 5 minutes, with a 5-minute dwell time. So it's quick. It's not the 3 hours of having to seal a room, which you get with HPV. So again, similar as previously, just to show you the results. Again, pretty clean already to begin with. So the post-clean was getting down to less than 10 CFUs. We sometimes have to take this in context because the cleaners were being watched. So there may have been added effort put in. However, in the next trial that we did, it was cleaned in advance, and the cleaners didn't know that this trial was happening. So we've been able to see both sides of it. Again, post-clean, really good results, but then the post-misting just takes off, just got that, particularly that underbed buttons, took it down from post-clean of 2,300 CFUs to less than 10. There are always discrepancies, and this is why we try and do as many trials as possible in different rooms, in different environments. So you'll see that actually the bin top, the counts went up after misting. There's always anomalies. That one particularly was quite sticky. There was quite a lot of biofilm, and although hypochlorous can completely get through biofilm, sometimes there are these odd anomalies with some of the results. But other than the bin top, everything else went down to less than 10. Okay, this graph just shows the log counts. So the log counts at pre-clean, then at post-clean, and then at post-mist. So showing that other than the bin top, post-mist, everything was less than 10. We then moved on to the second hospital, and again we were on ward 2 and took a variety of swabs, and again the room was swabbed and misted, and then final swabs were taken. So it was 4 minutes of fogging plus the 5-minute dwell time. So again, just showing similar results. So even the back of bed remote started at 160,000 CFUs and went down. It was a 3-log reduction. So it was still at 2,400, but it's a 3-log reduction down to the 2,400. The back of bed remote tends to be wiped on the front and not necessarily cleaned on the back. And this shows that the mist can get into lots and lots of hard-to-reach areas like the back of a remote control on a bed. Again, similarly, just showing the log reductions at each of those that intervention after post-clean and then after post-mist. So it's still at 3 logs for that back of bed remote, but it's gone down from 5. Again, we did a high dependency unit trial as well in 2 high dependency unit rooms. They were swabbed and then cleaned, and then re-swabbed and misted. So it's the same protocol that we're using throughout these trials. And again, looked at a variety of different locations, from bin lids to chairs to plugs to radiator tops. So trying to reach various points in the room. And again, you'll see that the cleaning is really effective in general. Most of them went down to less than 10 CFUs, and then the misting was just that added layer of hygiene across every single touch point in that room. So again, just showing the log count reductions at each of the interventions. So after misting, only 4 of the total 52 swabs that were taken showed any counts. And actually, out of those 4, there was still a 3-log reduction. So although it wasn't going down to 0, it was still 3 logs out of those 4. And in high dependency, 100% of the swabs were less than 100 CFUs. And if we think about 250 being the kind of higher limit, they're less than 100. And actually, you know, at every stage of human intervention, the log counts are reducing. In summary, again, just want to reiterate that at Betsi at Cadwaladr, the standard of cleaning is very high. Cleaning removed most of the surface bioburden, but the rooms that had been cleaned prior to arrival had slightly higher initial microburdens. Might have been some recontamination, might have been that when they knew we were coming, that they cleaned, then we were watching them, that they cleaned harder. Normal cleaning in high dependency unit resulted in 86% of samples returning less than 100 CFUs, and after misting, this rose to 100% of samples, so getting right down to less than 10 CFUs at all times. So in summary, out of the trials that we did, the current cleaning regime, which is the detergent plus bleach, is very thorough and effective. However, misting with Solvent confers an additional microbial reduction on surfaces where things can be missed. Right, I'm going to pass you over to Husain.
Right, so a new solution, hydromisting system, and our Solvent solution. We believe it'll be the new standard for area decontamination because it is so much faster, so much safer, and so much cheaper. So what is Solvent? Solvent uses hypochlorous acid, and hypochlorous acid is 300 times more powerful than bleach, which is a big statement to make, but yet it's still as gentle as water. What it's made up of is electrolyzed salt water, and it comes from our immune system. So whenever we do fall ill, our white blood cells produce the same substance to fight off any infections. So that's why it's still 100% safe to be around. There's no need for any PPE to be worn when using or handling our solution, and it has the same pH level as our skin. So how does the hydromisting system work? So we've created an all-in-one portable system where everything you need to disinfect an area is all together in one place. So the feedback we received from the Betsi Health Board was that when they were using HPV, they'd have to run to the storage room, take out the HPV unit, run back and get the ventilation covers or the masking tape or whatever else it is they needed. And they were spending a lot of time running back and forth. So now we've created a system where everything's in one place and it's a lot easier to use. So it's very fast. It's 80% more time efficient than the HPV process. You can do a single ward within less than 15 minutes from start to finish. It's very simple to use. You just need to press a few buttons, set the timers, and let it run its course. It's highly cost effective. When you compare it to HPV, it's over 80% more cost effective than HPV. As I mentioned, it's pH neutral, so there's no need for any PPE to be worn. It's very effective. We've proven it to have a log reduction of 6 across all bacteria and pathogens, and there's no clinical resistance as well. So to use the hydromisting system, you place it diagonally into the middle of the room, plug it in, make sure it's filled, and set the timer relevant to the size of the room. So depending on the size of the room, it'll need to be left on for a certain amount of time. After the misting is completed, it's always a 5-minute dwell time. So no matter how large the room is or how long you leave the misting system on for, it's always a 5-minute dwell time. That doesn't change. After the dwell time, the demisting system will kick in and remove any excess mist from the room. Once that's done, you can walk into the room, remove the system, and place it into the next ward and carry on. So we've been working with Betsi Cadwaladr University Health Board for the past 2 years developing the system. We've tried various different delivery methods and different sort of levels of hypochlorous, and we've come to the perfect concentration of the solution and the perfect delivery method. So the Health Board have actually purchased 8 of our hydro systems at the moment, and they've started using them throughout their hospitals. And going forward, they've decided that they're going to be using it in all of their acute sites and their community hospitals as well. As you know, they're not able to use HPV within the community hospitals. So this saves them having to send out cleaning teams with the HPV equipment to areas where they don't have trained operators, and they can use the Hydra system in all areas of the hospital. So the final question is that can Hydra and Solvent replace HPV? So from all the testing and the data and everything that we've received, we believe it can definitely replace HPV. So this is a quote from Paul, and this is our new system. So this will be one of the versions that we've created, and going forward we're always looking at improving and innovating our products and our systems to make it better and more user-friendly for you guys and easier for you guys to use. So any feedback you guys can give us, we'll definitely make them changes and make the system better for you.